The best time to take a strip test is 1 week after your missed period, usually around week 4 of pregnancy. At this stage, your body has enough of the HCG hormone, which the test detects. Here's how to do it right. Step 1. Gather your supplies, a clean cup, a test strip, and your first morning urine, which contains the highest concentration of HCG. Step 2. Collect a small sample of urine in the cup. Make sure everything is clean to avoid any contamination. Step 3. Dip the test strip up to the marked line, not above it. Hold it in the urine for 5 to 10 seconds, then place it flat on a dry surface. Step 4. Wait patiently for 5 minutes. 2 lines? You're likely pregnant. 1 line? The result is negative. No lines at all? That means the test is invalid. Try again. Step 5. If you're still unsure, retake the test after 48 hours. Remember, HCG levels double every 2 days during early pregnancy. Always follow the instructions on your test kit. And if your test is positive, congratulations. Contact your doctor for the next steps. Follow us for more pregnancy tips, support, and weekly guidance. You're not alone. We're here to help you every step of the way.